Hello guys, how are you all? Welcome back to MedSteps YouTube channel. So right now we are doing general surgery series. So today our main topic is highly examined topic in general surgery. If you are doing any general surgery department or clinical rotation, or you are preparing for your end exam questions or for ASCII settings, then it's very important topic. So it's like in surgery, mostly whenever you are doing any, if you are seeing any patient with like cancer or any other like obstruction problems, we can see this type of stoma. So stoma and the types of stoma today we are going to discuss. So whenever any surgeons perform operations for conditions such as colorectal cancer, intestinal obstruction, or bowel perforation, or inflammatory bowel diseases, okay, or severe abdominal trauma, they are situations where the normal passage of stool can't be maintained safely. In such cases, surgeons create an artificial opening on the abdominal wall to divert intestinal contents outside the body. So this opening is called, that artificial opening is called stoma. So simple. Okay. So as future doctors or medical students, it's extremely important to understand not only what a stoma is, but also why it's created, the different types of stomas and their indications, advantages, complications, and post-operative care, how to do. So everything we are going to discuss today in this topic. And at last, I will ask some questions. What are the things the doctor can ask in ASCII settings? Okay, so in today's this section, we will start from basics and gradually move to an advanced surgical understanding. By the end of this lecture, you should be able to identify different types of stomas and explain their indications and answering in Viva questions confidently and teach the topic to others. So without time waste, let's begin our class. So first of all, you can see here, this is the structure of stoma. Okay, so first of all, what it means. Stoma means what? For example, if you're seeing here, stoma means, the word stoma comes from Greek word meaning mouth. Stoma means mouth or opening. So a stoma is a surgically created opening between a hollow viscous structure. You can see this is opening. So hollow viscous structure, if anything, surgically opening between a hollow viscous and the skin surface, allowing diversion of intestinal or urinary contents outside the body, then we call that is stoma. So in simple language, if I want to tell means, a stoma is an artificial opening made by a surgeon on the abdominal wall. You can see here, this is the abdominal wall. In right quadrant, you can see the abdominal wall through which bowel contents or urine are brought out of the body. So why this type of stoma, when it started means, if you're seeing historical background, earliest colostomy described in the 18th century. Okay, so this modern stoma surgery evolved during world wars. That is the main thing. So its development of stoma appliances significantly improved quality of life. Simple. Okay, why every medical student, if they are doing like a general surgery department, they have to know stomas? Why? Because a surgeon will encounter stomas in different surgeries like colorectal surgery, trauma surgery, emergency surgery, and inflammatory bowel disease like ulcerative colitis and Crohn's disease. If the total rectum and sigmoid colon everything damaged, then diverticulosis, okay, and cancer surgeries and neonatal surgeries and urology. So this everything cause some different stomas. So based on that's why we have to know the stoma. So the clinical importance, why they are doing the stoma and everything means, it's a life-saving procedure, like temporary or permanent, and they prevent anastomotic leak and fecal contamination and intestinal obstruction and peritonitis. So most commonly we can see stoma, that is loop ileostomy, And most common permanent stoma will be like end colostomy. We will discuss these are the different types of stomas we have. We will discuss later. Okay. So what is a stoma? Actually, if you're seeing here, so what is a stoma? Stoma is a like we can see in rectal cancer patients and perforation and anastomotic leak. So whenever patient have this type of things, the surgeon can't safely allow stool to pass through the diseased bowel. So that's why the bowel brought through abdominal wall and they will open and they will suture to skin and the waste exits into the stoma bag. So this opening is called a stoma. So for example, if you're seeing that surgical anatomy, you can see this is abdominal wall layers. In this abdominal wall layers, you can see here that is skin and superficial cutaneous tissue and scarpus fascia and anterior rectus sheath and rectus muscle and posterior rectus sheath and peritoneum. So why through rectus muscle? If you are seeing here, this is the main muscle will give the stoma is usually brought through rectus muscle because it will give better support and less hernia formation and better blood supply. So if you're seeing here, this is the blood supply. You can see here the blood supply of ileum and colon. So this is the ileum, the blood supply, the ileum getting by superior mesenteric artery. If you're seeing colon, the colon will the blood provided by total superior mesenteric artery and inferior mesenteric artery for colon. Okay, so this adequate blood supply is critical. So poor vascularity and ischemia and necrosis and stoma failure will happen. So that's why blood supply is very important. That's why we are using mostly ileostomy and colonostomy because that blood supply is critical and important. Okay, if you're seeing nerve supply, we can see for this colostomies and everything, we can see autonomic nerves, sympathetic and parasympathetic, but no voluntary sphincter control. So hence the stool continuously exits. So if you are seeing the physiological point of view, this is the stoma, it will look like this. So you can see here in normal physiology, we can see like food, then after it will digest, then after it will become absorption, then after defecation via anus. So this is the normal physiology. But after stoma formation, the patient will take food, they will consumption, then after you can see digestion, then after stoma, then after it will go to stoma bag. So normal anal continence is bypassed. So this is the things. So now you can see here, this is the stoma. In the stoma, here you can see like this, we will make the stoma bag. So to create an opening to stoma to allow passage the bodily content. So I already told this, we already discussed, this is artificial opening. So brought to the skin surface and collected externally stoma bag. So it will be like temporary to divert flow which healing occurs. In some cases, if some cancer patients, they will fix temporarily, then after they will make like normal. Okay, so another one we have that is permanent means normal root damage permanently, so lost, so always the whole life they have to live with the permanent stoma. So this is very important, most important examination area. So that's why we have to know the classification of stomas. We have different types of stomas, that is colostomy and ileostomy and urostomy and jejunostomy and gastrostomy. So everything we will discuss step by step. So first of all, we are seeing here that is ileostomy. If you are seeing here, this is ileostomy. Ileostomy means most common diverting stoma created from terminal ileum. So this is the ileum end of the small intestine to the abdominal wall. Okay, so usually we can see that ileostomy we can see in right iliac fossa. In right iliac fossa, we can see ileostomy. So how the characteristics, how it will look like means after colostomy, after colectomy, example like ulcerative colitis or familial polyposis. Okay, our output is liquid to semi-liquid, we can see. Okay, the characteristics of stoma, how it will look means it will be like pink, moist, and it will be like protrude you can see here this protrude, it will be like 2 to 3 centimeters, and you can see liquid output and high output. Okay, so when we have to do this ileostomy, the main indications, if any patient have ulcerative colitis or Crohn's disease, or rectal cancer, or anastomotic protection, or familial polyposis and trauma. So these are the main types of ileostomy we can see. So next, in ileostomy, we have total three different types of ileostomies we have. That is, first one we can see here, that is end ileostomy. In end ileostomy, we can see here uh, the one end of ileum brought to skin, and it used after total colectomy or proctocolectomy or permanent diversion. So next we can see here, that is loop ileostomy. That loop ileostomy means most common temporary stoma, we can call that thing loop ileostomy. This is the most common loop of ileum brought out and opened partially, and it has proximal, you can see here, this is proximal loop and distal loop. It will use to protect that anastomosis. Okay, and next we can see another one, that is double barrel ileostomy. I will show this image when we are discussing that Viva based questions. That time I will show that picture properly. Okay, so double barrel ileostomy. So this double barrel ileostomy, you can see both bowel ends exteriorized, and it will be like rare nowadays. No one using that much this type of colostomy, this ileostomy. Okay, next we are going to discuss about colostomy. Colostomy means it's like colon to the abdominal wall, and it diverts feces after partial colectomy, or in colorectal cancer patients we can see colostomy. This colostomy will be like, we have two different types of colostomies. One is loop colostomy, another one end colostomy. Loop colostomy we can see two openings, and end colostomy we can see one opening. So this colostomy will created from large intestine and output more formed like less fluid loss. Okay, so in types of colostomy, we can see end colostomy and loop colostomy and double barrel colostomy. So here the duration will be like, we can use that colostomy into temporal or permanent. The site will be like, based on that colostomy colon site, like ascending, transverse, descending, sigmoid colon we can use. So in end colostomy, mostly we can see here, in the colostomy will be mostly we can see in left iliac fossa, and ileostomy will be like right iliac fossa. So based on that site, we can differentiate what type of stoma they have. So first of all, here you can see, that is end colostomy, most common permanent stoma we can see. And examples when they are going to do, if they are doing any Hartmann procedure, this is very important in exam point of view. Hartmann procedure. If anyone doing Hartmann procedure, they are going to do end colostomy. Next, we can see here, that is loop colostomy will be like temporary diversion and usually transverse colon. And next we can see, that is double barrel colostomy. It will be like proximal and distal ends exteriorized and separately. Okay. Next we can see here, that is urostomy. Urostomy means it's like ileal conduit or cystectomy patients, we can see this urostomy mostly. It will be like diversion of urine through a segment of bowel ileum connected to the ureters and brought out to the skin. So we can see urinary diversion, most commonly ileal conduit we can call, and used after cystectomy. Most commonly we can use this type of urostomy. So you can see here, this is the normal structure. Okay, but here if you're seeing means from this bladder, we can see this ureters attached. Then after you can see stoma outside the body, it will look like this. So conduit, because of inside the body, that's why we call that is conduit. Okay. Next we can see here, that is gastrostomy. Gastrostomy means it's like stoma in stomach for feeding, like peg tube we can tell. So if patient is unable to swallow, or patient have any neurological conditions or esophageal cancer, then we are going to use gastrostomy for opening from stomach to skin, for like peg tube, or we can call feeding gastrostomy. feeding, gastrostomy. Okay, so these are the things we call gastrostomy. Next, you can see here that is jejunostomy. In jejunostomy, we can see that patient have feeding stoma into the jejunum, and the long-term feeding will be like stomach can't working. In long-term feeding, if patient the stomach is not working, then we have to use this jejunostomy. This jejunostomy used for mostly enteral feeding. Examples like feeding jejunostomy after upper GI surgeries. Okay, next one we can see here that is tracheostomy. Tracheostomy means it's like windpipe to allow breathing. For upper airway is blocked or for long term ventilation we are going to do tracheostomy. So this type of thing for giving if patient getting proper patient can't take breathing properly, then we can use this tracheostomy. In emergency cases we can use these things. Okay, next we have some classification. Based on the classification we are going to divide. One is temporary stoma and permanent stoma. So temporary stoma will be like can be reversed. Example like loop ileostomy and loop colostomy, as we discussed before. Next we can see permanent stoma, that is can't be reversed because example like abdominoperitoneal dissection if anything happen, or any colostomy. Okay. So next we have classification based on construction. So here you can see here based on construction we can see one is end. We discussed before. End means what? Only one bowel end we can see. Next we can see that is loop. Loop means bowel loops we can see. Double barrel means two bowel ends we can see. Next divided loop means separated limbs. Okay, so these are the things. So indications when we have to do like when we have to do surgery for stoma means like cancer, example colorectal cancer, bladder cancer, or inflammatory bowel disease we already discussed, and trauma and obstruction like tumor or adhesions and neurogenic bladder. Okay, and bowel dysfunction or prolonged ventilation and tracheostomy. So how is a stoma made? First we have to identify and mobilize the segment of the organ to be enterized. So we have to bring it through the abdominal wall in neck. Okay, then after we have to suture it to the skin to prevent retractions. Then after we have to ensure good blood supply and function. Then after we have to attach an appliance like stoma bag it for waste diversion. So how we have to ensure means the surgeon must be, they will check the stoma will be like pink or moist or well vascularized or protruding, no tension and no ischemia, and usually appliance fitted means then it's like well blood supply and function is working. Like that we have to understand. So the common stoma sites if you are seeing means that is ileostomy will be in right lower quadrant, right iliac fossa. The colostomy will be like left lower quadrant and left iliac fossa. Okay, so the characteristics of stoma we already discussed, that is pink to red, good blood supply is there, then after moist and slightly protruding from skin, and we can see painless because no nerve endings will be there. Okay, so these are the things. Next, next we can see here we can some complications. If you are doing any stoma, we can see some complications, that is in early complication the patient will get bleeding, an infection and ischemia and necrosis because of lack of blood supply and hypoperfusion, and we can see retractions like hernia and leakage. So in late complications of stoma we can see parastomal hernia means totally it will come outside. Okay, then after we can see stenosis like narrowing of stoma. Okay, then after we can see prolapse like bowel segment coming to far out, and we can see skin irritation and psychological issues. Okay, next how to do the stoma care. We have to educate the patient on stoma appliances, how to use and everything, how to clean and everything. We have to teach the patient. We have to give proper guidance and education. Then after skin care to prevent dermatitis, because in stoma, if you are keeping any stoma, the patient is going to get dermatitis and dermal problems because of and that is waste material is coming outside. If that spread, the patient will get dermatitis. So we have to, the patient have to do skin care and we have to guide. So next one, output monitoring. Then after emotional support we have to give. Then after we have to watch for complications. Okay, in if any patient have like ostomy means It's like creating an artificial opening. The purpose to allow passage of food, fluid, waste, or air, and it can be temporary or permanent. If the doctor is asking, tell me about stoma, you have to tell these 3 points. It's enough. Okay. So next, how in exam settings, how the doctor can ask questions means now we are going to discuss that question discussion. Okay. So mostly these are the questions the doctor asked me in during rounds, in during procedures, in during surgery, in operation theater room. These are the questions the doctor asked. So that's why I mentioned here. So the question will be like difference between a stoma and fistula. Stoma will be like surgical created artificial opening, intentional opening, and controlled. Fistula means abnormal and pathological communicated between unepithelialized surfaces. So types of stomas we discussed already: colostomy, ileostomy, urostomy, ileoconduit, or gastrostomy, jejunostomy, and tracheostomy. These everything we discussed properly. Okay, so if anyone asking what is a stoma means, a surgically created communication between a hollow viscous and the skin in simple language. Most common temporary stoma is loop ileostomy. Okay, so most common permanent stoma will be like end colostomy. Okay, why does ileostomy protrudes? Means to prevent skin excoriation from digestive enzymes. So this is the main concept. That's why we will pull 2 to 3 centimeters more. So the indications of colostomy: if patient have colorectal cancer, Hirschsprung's disease, diverticular disease, trauma to the colon, and distal rectal obstruction. So indications of ileostomy, you can see ulcerative colitis after total colectomy and familial adenomatous polyposis, Crohn's disease, inflammatory bowel disease with perforation, and protecting a distal anastomosis. So next we can see that is difference between colostomy and ileostomy. Colostomy we can see in right side, left side, and ileostomy we can see in right side, iliac fossa. This is left side iliac fossa, and formal in colostomy we can see form stools, less frequent emptying, and larger caliber. In right side, in ileostomy, we can see right side, in right iliac fossa, liquid stools we can see and frequent emptying and smaller caliber and more enzyme rich irritant. So what is a loop colostomy? Loop of a colon is brought to the surface and opened, creating a stoma with 2 openings. So one for fecal diversion, one for mucus drainage, often temporary. So this is the end. This is the end colostomy. You can see here. This is like only one loop. This is loop colostomy. You can see 2 loops going out. You can see in ileostomy. Next, you can see end loop ileostomy. So this is the things. Okay. So what is a double barrel colostomy means? We can see two. One is active portion of colon and another one inactive portion of colon. So the bowel is divided into both sides and brought to the skin with the 2 separate stomas, but usually in same wound we can see one for feces, one for mucus. Okay, so what is Hartmann's procedure? Because mostly after Hartmann's procedure only patient will get colostomy. So in Hartmann's procedure we have to do midline incision. After doing midline incision, a resection is disease sigmoid and or rectosigmoid colon with closure of rectal stump and form of an end colostomy. They will stump here and they will stump here and they will create artificial colostomy. It's a new outlet. This is sigmoid and sigmoid colon and normal this colon will the rectum and everything will closed. Okay, here the rectum will closed. Okay, so here if any patient have cancer, rectal cancer, then only they are going to do Hartmann procedure. After Hartmann procedure, they are going to do end colostomy. So what is a parastomal hernia? This is the most common question the doctor can ask in surgery department. So hernia occurs adjacent to the stoma site through the abdominal wall defect created for the stoma, that is parastomal hernia. So mucus fistula means distal segment of bowel brought to the surface to drain mucus in a double barrel stoma. So we have to advise to stoma patients, stoma care and hygiene, and appliance fitting and emptying, skin care to avoid irritations like dermatitis, and we have to give some dietary advice to avoid obstruction in ileostomy and drink plenty of fluids, and we have to recognize the signs and complications of the stoma. Okay, so why The which stoma has highest output means that is jejunostomy. So a healthy stoma should always be pink, moist, and slightly protruding. If it becomes black or purple and dry, we have to think the patient like getting ischemia or necrosis, so which is a surgical emergency. Okay, so in conclusion, we have in conclusion, I want to tell some things like major types of stoma will be like ileostomy. In ileostomy, you can see end, loop, and double barrel. Next, same to same colostomy also we can see that is end, loop, and double barrel. We have types of colostomies. Next, we can see urostomy, jejunostomy, and gastrostomy, and another one tracheostomy. So these are the things. So in summarize, a stoma is a surgical created opening between a hollow viscous and the skin surface designed to divert fecal or urinary contents outside the body. So depending on the organ involved, stomas can be classified into ileostomy, colostomy, urostomy, and gastrostomy and jejunostomy. So, in this video, we also learned that stomas may be temporary or permanent and can be constructed as end loop or double barrel stomas depending on the clinical situation. Remember, these are the things high yield examination points. So, the most common temporary stoma is a loop ileostomy. Okay, while the most common permanent stoma is an end colostomy. A healthy stoma should always be pink, moist, well vascularized, and slightly protruding. So, understanding stomas is essential because they are frequently encountered emergency surgery, colorectal surgery, or trauma surgery, and cancer surgery. Properly knowledge of trauma creations and care can be significantly improve patient outcomes and quality of life. So thank you for watching. If you didn't subscribe my channel, please subscribe. If you have any doubt, you can ask me in comment section. So same to same, I already covered many topics in general surgery series. If you didn't watch that videos, you can like and you can watch that videos, so you will get one idea. So I'm signing off. If you have any doubt, you can ask me in comment section. Till the time, take care.